Hi, my name is Salima. I'm going to be Mr. Tom Burgundy's nurse today. What's going to happen is I'm going to walk into his room and change his dressing. He's got a dressing on his left shin, so I'll be replacing that for him today. And first things first, I've double checked my patient profile. I've got the right person and I know what I'm doing today. I'm going to gather all my equipment, but first I'll wash my hands. I've washed my hands with soap and water just then. So for the purpose of this process, I'm sanitizing my hands. First things first, I've got my trolley, which I need to disinfect. So make sure I've disinfected the whole trolley, including the rails. And then I'll be left. And then wash my hands. And then I'll gather the rest of my equipment. I'm going to need a bin. Going to need my basic dressing pack, which has everything I'll need for the procedure, all in here, and it's all sterile. So I'll put that on the top. I'll need 2 sets of gloves, 1 and 2. I will need my patient profile just to make sure I've got the right patient. And I will take my sanitizer with me. And let's go meet Mr. Burgundy. Hi Tom, my name is Salima. I'm going to be your nurse for today. So I'm changing your dressing on your left shin. I hope that's okay. I'll just double check your name tag. Oh, it says Tom Burgundy. Great. At this point, I'm just going to adjust the bed and make sure Mr. Burgundy is comfortable. Is that okay with you? So, yeah. And then I'll check the brakes to make sure he doesn't go anywhere during the whole process. Okay? Now, Mr. Burgundy, I am going to take down your bed sheet and I'm going to change your dressing. Is that okay with you? I think he said he's fine. Just going to wash my hands before I do that. I've got a few questions to ask you. Would you like to go to the bathroom? Oh, he said he's been. Would you like any pain relief or anything? No? That's great. So I'm just going to take the bed sheet down. I'm just going to fold it so that it doesn't touch the floor. There we go. And now I'm going to set out my little area. Wash hands. Because everything in this pack is sterile, I'll make sure I don't touch anything with my hand except these two, because they're in individual packs. I'll put those there for now. And then what I want to do is to take the tray and the thingy out of the bag without touching it too much. There we go. And we begin that. And then this needs to be opened. And we'll get the dressing out. And we bin that. So I'll try to open it just by touching the edges and not touching the whole sheet. So if I pull it out from here, that way, I'm only touching the edges to spread everything out. Make sure I cover the whole tray and try to touch it from the bottom and not the inside, because the inside is sterile. Okay, so now that I've got everything there, I'll sanitize my hands just before I get my tweezers or clamps. Just going to spread everything out. Okay. Okay, so what I'm going to do is get my sterilizer, water, sodium chloride. Yeah. I'll check the expiry date. Oh, look at that, June 2021. And I'm going to squirt that in there. And this is my prep. What I'm going to do is I'll prep the gauze. Make sure I wet the gauze, not too much. Don't want it to be too wet because you don't want it to be uncomfortable for the patient. There we go. Okay, so now I will prep Mr. Burgundy. Just gonna push my trolley a little bit closer to him. Hi Tom, just gonna put this underneath your, I'm just gonna put this underneath your leg. And just for the purpose of this video, I did grab this with my hands, but in reality, you have to use the yellow tweezers to grab anything from this area because this area is sterile. Okay, so I'm going to put Mr. Burgundy's leg over this just in case I make any mess. Everything stays on here and it doesn't mess his bed. 1, 2, 3. I'm lifting the leg up. There we go. And then next thing is wash your hands. And then I'll get my first pair of gloves because I'm about to take out the old dressing and replace it with a new one. So gloves on. Now we've got gloves on just in case because we're coming into contact with possibly body fluid. Okay. So I'm going to gently tell Mr. Burgundy, I'm going to take your dressing out. It might be a little bit painful. If you're uncomfortable, please let me know. Okay? He's okay. So I'm just going to take the old dressing out. I'm gonna try to be as gentle as I can. It's a little bit sticky because we're using plastic, but in real life it won't be that sticky. So I'm going to take that and put it in my bin area. And I'm going to take these gloves off and bin them as well, because now these gloves are infected and I'm trying to clean his wound. We don't want to use them again. So the next thing I'm going to do is wash my hands again. And then I'll get my second pair of gloves. Okay, once that's done, I'm going to now clean the wound so that I can put the new dressing on. And how we do this is by getting your tweezers and picking them up. So what's going to happen, I'm basically going to use one to come into contact with his wound and the other one, the sterile one, to come in contact with this area. That way it's more hygienic. Okay, we ready? I'm just gonna swipe it down nice and gently. I'm not gonna go over it too much because we've got plenty of gauze to clean it up. There we go. Oops. If that happens, you just pick it up quickly and you put it in the bin. Once that's done, I'll put my tweezers down. I get my new dressing, which is in its own sterile pack. Take that out, clean that. Now with this one, it comes like this. So that way you don't have to touch any sticky bits. You can just open it and put it straight onto the injured area nicely. So we'll do that. There we go, and I'll press it on there just to make sure it's stuck on there nicely for the next nurse that comes in later. Okay, once that's done and it's nice and neat, I'll take this and gather everything into the little sheet thing, and I will fold everything in there. Spin it. Wash my hands. And then, Mr. Burgundy, would you like your sheet back on? Yes, he wants his sheet back on, so I'll put it back on for him because he might be a little bit cold. Do you want me to put the bed down, or are you comfortable like this? I think he's very comfortable. I'll just make sure he's got his cold bell right next to him or underneath his pillow within reach for whenever he might need assistance. And I'm going to wash my hands and let him have a rest. And thank you for watching my video.